Good day. Thank you for joining us for today's news. If you find this helpful, please consider subscribing. We're here every day with calm, clear updates just for you.
New Zealand is currently under the threat of severe weather as heavy rain and strong winds sweep across the country. Orange-level heavy rain warnings have been issued for a wide range of regions, including Auckland, the Coromandel Peninsula, and the Bay of Plenty. Among others, strong wind watches are also in place for parts of the North Island. According to Met Service, this weather system is being driven by a fast-moving front traveling eastward, and it's expected to last into Wednesday morning. Residents are being urged to stay informed and prepare for potential disruption. In some areas, like the Waikato region, heavy rainfall has already begun to over Raymond. Power outages have been reported in several locations, with utility companies working to restore services. Emergency services are on high alert, ready to respond to any incidents that may arise. As the storm continues, the focus remains on minimizing the impact on communities and ensuring the safety of all residents.
Maya Joseph and Kapo Olsen-Baker are two of the newest members of the Black Ferns, and they're about to step onto the world's biggest rugby stage. This will be their first Rugby World Cup, and both players are excited, but also aware of the challenges. Joseph, who recently got a black eye during training, says the intensity has increased drastically. She's taking advice from veteran player Kelly Brazier, who has been to 4 World Cups. Brazier's tips have focused on being present and making the most of every moment. Olsen-Baker, who missed the 2021 World Cup due to injury, is eager to get back on the field. She admits being away from her family will be tough, but she's grateful for the support of her partner and their families. For both players, the journey to the World Cup has been a mix of anticipation and challenges. Joseph was at home during the last World Cup final, recovering from an ACL injury and watching the Black Ferns. Now, as the team prepares to fly to England, Joseph and Olsen-Baker are ready to embrace the opportunity of a lifetime. It's a chance to prove themselves on the global stage and to be part of a team that has become a symbol of excellence and national pride.
New Zealand is currently experiencing heavy rainfall and strong winds, with several regions under orange-level flood warnings, the National Emergency Management Agency. In the event of power outages or communication disruptions, using battery-powered radios is recommended with climate change, making extreme weather more frequent. Communities are being urged to take proactive steps to protect their homes and loved ones. This weather event highlights the importance of emissions preparedness and the need for resilience.
Dargaville Hospital has lost its only full-time doctor, deepening a staffing crisis that has been affecting rural hospitals across New Zealand. This loss comes as the hospital already struggles with a shortage of medical personnel. Now, the 12-4 required for 24-hour coverage. In response, the hospital has turned to nurses and a telehealth service to cover overnight care, with doctors providing remote slips when needed. However, this arrangement has its limits. Unstable patients are often sent to a larger hospital in Waingaroa, adding strain on ambulances. The doctor who left the hospital had been committed to the community, even buying a home in the area. Her departure has left the hospital further from its goal of reinstating full medical services. Despite these, stating that staffing levels have not changed since late last year, restoration efforts are ongoing, but the lack of a 24-hour medical presence remains a concern. Health Minister Simeon Brown has announced a $164 million program to expand after-hours services across the country, with improvements expected in 2026 and 2027 in tour. While current arrangements have allowed the hospital to continue operating, the lack of a 24-hour medical presence and the strain on existing staff underscore the urgent need for long-term solutions.
A heartbreaking story unfolds as a newborn baby dies after a midwife leaves the room for 25 minutes during a critical postpartum period. The baby, born in 2015, was being breastfed when the midwife, Lessa Haynes, stepped out to complete paperwork. When she returned, the baby was unresponsive. Citing emergency efforts, the infant suffered irreversible brain damage and was later taken off life support. A coroner's inquest revealed that the midwife failed to maintain proper vigilance, leading to a preventable death. Coroner Bruce Hesketh criticized Haynes for leaving the room during the crucial skin-to-skin contact and first messing session. The incident highlights significant lapses in maternal care and GUSCs, the need for improved guidelines on postnatal monitoring. The baby's parents, first-time parents, said they were unaware of the risks and relied on the midwife's guidance. The coroner's findings emphasize the importance. This tragic case serves as a stark reminder of the critical role healthcare professionals play in ensuring the safety of newborns and the need for systemic changes to prevent such incidents in the future.
More than 36,000 nurses and midwives across New Zealand are preparing to strike for 24 hours starting this Wednesday, the action which will affect all healthcare services. Provided by TASE's union has criticized the government for ignoring chronic short-staffing and unsafe working conditions. Union leaders argue that the current system is failing patients and healthcare workers alike. They claim that the lack of recruitment and competitive pay is pushing nurses to leave the profession despite Health NZ's offer of a 11% pay increase. For new graduates, the union says the deal doesn't address the core issues. The strike is not just about pays, about ensuring that healthcare workers can deliver timely and safe care. Health NZ has assured that life-preserving services will continue and urged patients with non-urgent ailments to consult their GP first as the nation braces for the strike. The Citrate
New Zealand's dairy industry is set for another strong season, with the NZX futures market pricing supporting a $10 per kg milk solids farm gate milk price for the 2026 season. This follows a strong start to the season and increased production in August, with the peak exprunget due. Fonterra's confirmed milk price for the previous season was $10 kg, and the midpoint for 2026 is also at this level. Economists note that 2 consecutive high milk price seasons are rare, but if this trend continues, it could boost the dairy sector's contribution to the New Zealand economy by around $10 billion over 2 years. James Atkinson from NZX says that the current strong prices are a good sign for farmers, with many expected to profit. The upward trend in milk price futures is being driven by strong global demand, particularly for whole milk powder and skim milk powder, despite increased volumes coming online in New Zealand. Prices have remained historically high, supported by strong demand and a steady New Zealand dollar. NZX head of dairy, Christina Alvarado, points out that global production trends are favorable for New Zealand, with key dairy-producing countries like Germany and France struggling, while New Zealand's production has been struggle. In China, domestic dairy production is declining, but demand has stayed steady, further supporting New Zealand's exports. Looking ahead, NZX futures for the 2027 season point to $9.50 kg. ANZ's latest agri highs ensured no shortage and feed. Last season's milk production rose by 3%, the largest year-on-year gain since 2014-15. The report suggests that with the right conditions, growth of only 3% should be attainable in 2025-26, as the dairy sector continues to benefit from strong global demand and favorable local conti.
In 2019, a group of Pacific law students launched a campaign that would eventually lead to a landmark advisory opinion from the International Court of Justice. Their goal was to get the ICJ to weigh in on what international law requires states to do about climate from the ICJ, and in March 2023, the court held 2 weeks of hearings in late 2023 and issued its advisory opinion in early 2024, finding that states have legal binding. While the opinion is not legally binding, it carries significant legal and polemic movement, giving renewed courage and determining.
A powerful gathering of Maori women in Totahi has brought together over 50 women to reclaim and protect the sacred Karanga Turetu, Pereru, and led by the Rapi Te Kekwai Mekura Oats Kanjangirea. The event celebrated 5 respected Merekura and emphasized the living Tukanga of Karenga. The Vonanga aimed to empower Mori women, deepen their understanding of their place in Te Mori, and challenge the notion that Karanga is only for the fiery process. Rahomare was chosen for its inclusive nature, and the event highlighted the strength of Mori women and their deep connection to cultural ikate.
In a significant move to honor the legacy of abuse and neglect suffered by countless New Zealanders in state and faith-based care institutions, the government has announced that November the 12th will be designated as a National Day of Acknowledgement. The decision comes as part of a broader effort to confront the painful history of institutional abuse and to ensure that survivors are at the center of the commemoration. Lead Kana $1 million contestable fund will be made available for local and regional events, empowering survivor-focused groups. The announcement follows the release of the Abuse in Care Royal Commission report in July 2024, a 6-year investigation that exposed the systemic fair institutions. The report described the abuse as a national distaste. Children, young people, and adults were in care between 1950 and 2019. Around 200 survivors attended Parliament to witness Luxon's formal apology, a moment described by the Prime Minister as deeply personal and reflective of the nations. The program, which involved the use of electric shocks and paraldide injections, has prompted the establishment of a redress pool. The government's efforts to address the legacy of abuse in care are not limited to 5-century redressings. The focus is on ensuring that surmemorization, the full case is all. This approach reflects a growing recognition that healing requires more than monetary compensation. It demands a collective reckoning with the past and a commitment to preventing such harm from occurring again.
That's all for today's news. We appreciate your time. If you enjoyed this update, please consider subscribing. Your support helps us keep going.